Now I'm telling short question. 100% I'm saying one question I'm expecting from this. Okay, this may or may not be, but this one particular brachial arches, just remember, if you want to leave anatomy, you are saying that I am not studying anatomy for FMG. If you are saying like that, don't forget about brachial arches and their derivatives, the brachial plexus, and the injuries produced in that. These three topics, if you leave, you will fail FMG for sure. Okay, right. So let's see about the brachial arches and the derivatives of that. So look over here, how these brachial arches are formed and all around the neck and everything. That would have been covered in theory part. I cannot pay right now more emphasis on that. You may remember like this. See, first arch, you have to remember the arch number. What they have asked you, the muscles, mainly muscles. See, this bones and muscles both are as in asked. In my exam, I got 2 questions. I'm telling you. In my NEET PG also, I got 2 questions. NEET PG also 2 questions. MC also 2 questions. Okay. So first arch, the nerve that are associated with this arch is mandibular nerve, your chorda tympani, and maxillary artery. Nerve and artery are mainly to be checked. See, if you remember, the muscles that are supplied by this nerve are usually the brachial derivatives of this. Okay, you can remember like this. Okay, so look over here, muscle of mastication. Which are the muscle of mastication? This muscle, that is temporalis, supplied by here is the twist. Okay, okay, fine. So just remember, muscle of mastication is for 1. Then these are medial pterygoid, lateral pterygoid, temporalis and all that has been done. Then anterior belly of digastric. Now you remember, anterior is over here, whereas the posterior is in the second part. So this can be a question for sure. Anterior belly of digastric in the first arch, posterior in the second arch. Then tensor palatii and tensor tympani. These both tensors are also derived from the first arch. What about the skeletal derivative? Malleus incus. Did I say stapes? No, I didn't say stapes. Stapes will be here. So this is also important. Both the out of the 3, 2 the inner ear, middle ear bones are generated from the first arch, whereas the stapes is from the second arch. So this is a potential question. Okay. Now this was the question in my MCI, that was zygomatic bone is a derivative of which arch. Okay. So somehow you have to do it. Then Meckel's or mandibular process is also derivative of first arch. About second, basically it is facial nerve and stapedial artery. See, stapedial artery, you remember second as S, second is S, right? So everything start with S. Look over here, stapes, styloid process, stylohyoid ligament, lesser cornea of hyoid, and superior part of hyoid. Okay, everything related to S. Stylohyoid muscle also, stapedius muscle also, stapes also, everything is S over here. Okay, everything is S over here. Remember like this. Third is the glossopharyngeal nerve. So how I remembered? See, 1 is 5, 2 is 7, 3 is 9. Okay, 3 is 9, and this 4 and 6 are 10 because recurrent laryngeal and superior laryngeal nerve are derivatives of vagus nerve. Okay, so this is the mnemonic. You can remember like this: 1, 2, 3, 4, 6. Remember, 5th is not there. 4 and 6 just 5 and 6 just combine and make it 6. 5 is not as present as arch. Okay, so 1, 2, 3, 4, 6. Now if I say 5, 7, 9, 10, 10. Okay, 5, 7, 9, 10, 10. Okay, 10, 10. One is superior and one is the recurrent. Now you know it well. All the muscles of larynx are supplied by, please tell me, all the muscles of larynx are supplied by recurrent laryngeal nerve. If you are studying ENT or if you are studying anatomy, this line you should write in your bold on your table. In your bold you have write that all the muscles of larynx are supplied by recurrent laryngeal nerve except the cricothyroid, okay, which is supplied by superior laryngeal nerve. Please remember this. If you are studying ENT, this is must for you. Okay, fine. Remaining, I'm not expecting that how. Okay, here if upside was the lesser cornea of hyoid, so here the greater cornea of hyoid I can suspect. Okay, one of the most important. Some say, sir, you said everything SSS is in second arch, but see this stylopharyngeus, it is in the. Array, use some of your brain. Stylopharyngeus, please see glossopharyngeal nerve, isn't it? It is so simple. Huh? This nerve is supplying that, so that is why it will be present. Okay, so all this S series will be supplied by second. Style of fringes, don't write.